Principal Secretary, Dr. Omar Oluga, Principal Secretary for Environment, Engineer Festus Ngeno, my friend and colleague in Parliament for many years and the chair of the National Assembly Parliamentary Committee on Health, Dr. Nyekal, the CEO of Council of Governors, who is representing the chair of the Health Committee of the Council of Governors, Dr. David Ndegwa, the chairperson of the Kenya National Public Health Institute, the Secretary of SCAC, the representative, Dr. Lucy, the Regional Director, Eastern Africa, Regional Coordinating Center for Africa, CDC, my brother, Dr. Diallo, the WHO country rep, Dr. Amoth, our Director General, distinguished guests, ladies and gentlemen, good morning. It gives me great pleasure to be here today, joined by the Principal Secretaries for State Department for Public Health, Professional Standards, presented here by the many directors from that department, and the Art of Medical Service, the chairman and the board of directors of the Kenya National Public Health Institute, distinguished guests, and all partners and stakeholders present. The Kenya Kwanza government, under the bottom-up economic transformation agenda, has placed health at the core of the national development. We are committed to strengthening the universal health coverage, enhancing preventive and promotive health care, and building a resilient system that supports a healthier population and stimulates socio-economic growth. Ladies and gentlemen, the events of the recent years, from the COVID-19 pandemic to the Ebola outbreaks in neighboring countries, have taught us hard lessons. They have demonstrated that no country is immune to global health threats, and that preparedness, early detection, and rapid response are not optional, but they are very essential. We must have strong institutions capable of acting swiftly and decisively to protect the health of our people. And this is why the National Public Health Institutes are so vital. Around the world, the National Public Health Institutes serve as central hubs that bring together surveillance, emergency response, health research, and policy coordination under one roof. They eliminate duplication of efforts. They align national policies with international standards, such as the WHO's international health regulations, and they ensure public health threats are managed quickly, effectively, and comprehensively. It is with this context that I am proud to announce the official launch of the Kenya National Public Health Institute, established through a legal notice number 14 of January 18th, 2022. The Kenya National Public Health Institute has been founded to strengthen the Kenyans' leadership and coordination in public health security and emergency response. It provides us with a unified platform to prioritize public health needs, mobilize resources efficiently, build laboratory and workforce capacity, and generate research that will guide our national policies. Recognizing that some of these functions already exists within the Ministry of Health, we needed a deliberate and structured transition. In November of 2024, we established a multi-agency task force comprising of representatives from the Executive Office of the President, the National Treasury, the Public Service Commission, the Attorney General's Office, the State Corporation Advisory Committee, Ministry of Public Service, and other key institutions. On February 20th, 2025, the task force presented its report to the Chief of Staff and Head of Public Service, Mr. Felix Kosgei, with clear recommendations for a seamless transition. Today, I'm proud to announce that 13 key divisions and programs, including disease surveillance, zoonotic disease management, emergency operations, health informatics, and the National Public Health Laboratories have now officially been transferred to the Kenya National Public Health Institute. These transitions makes a historic shift in how we coordinate and manage public health in our country. Allow me at this point to sincerely thank our partners, the World Bank, Africa CDC, AMREF Health Africa, the US CDC, and the International Association of the National Public Health Institute for their invaluable support, both technical and financial, in the operationalization of the Kenya National Public Health Institute. I am informed that this institute is working to expand this partnership even further, both locally and internationally. That said, to complete the transition and ensure full operational capacity, I urge the Public Service Commission to fast-track the approval of the Human Resource Instrument of the Kenya National Public Health Institute. Furthermore, I call upon all ministries, departments and agencies, our county governments, and I want to assure the CEO of the COG that you'll have a chair at the table of the board of the KNPHI, and other non-state stakeholders to rally behind Kenya National Public Health Institute's leadership. Our collective action must support this important institution through the office of its current Acting Director General. Ladies and gentlemen, today marks not just the launch of a new institution, but the beginning of a new era of public health in Kenya. The Kenya National Public Health Institute must move with speed, precision, and vision to achieve its mandate and keep our country safe. Just to add one more thing, and I really want to ask colleagues at the Ministry of Health and in the entire government, that days are gone when we want to run the affairs of government in corners, in silos, or on the corridors. And that's why I made a decision and told colleagues in the Ministry of Health, both state departments, that decision making is a critical component of leadership. And that among the many things I found on my table when I became the CS Health was this baby who was, the mother was around, the health facility was not very far, the doctors were ready, the nurses were ready. The pediatricians led by Dr. Nyekal and his team were ready to protect the baby the later stage. But there was nobody to do that decision to the mother that the due date is around the corner. And I had to make a decision. But my decisions are always very consultative. My decisions are always very participatory. I'm one person who believes in the provisions of the Constitution of Article 10 and Article 118 on public participation. So colleagues here from the ministry, from all these directorates, the heads, we had a meeting and we agreed in principle that we are making the right move, not for the interests of Kenya alone, but to be part of the global decision making. And I'm sure next week when we go to Geneva to attend the WHO assembly, we have something to report that ultimately we have joined the League of Nations that have previously established their own National Public Health Institute. So what we're doing is something that will make Kenya, and it is, a leader in health sector. And I'm sure once we finalize and it becomes solid, the universal health coverage, Kenya will be one country that many other African countries will come and learn from. But I want to assure the people of Kenya finally that I and the team at the MOH, and both at the level of the Council of Governors, are committed to create hope and trust on behalf of the people of Kenya to the health system that they have in their country. It's now my distinct honor and privilege to officially declare the Kenya National Public Health Institute officially launched. Thank you, and God bless you.